So this is the glucose test, and once again you can see we're looking for color changes, and you can actually, compare those colors onto this chart. And anything A is definitely normal, that's very low glucose. This is a desirable amount of glucose in your blood, and this is borderline. This would be somebody maybe who has that pre-diabetes. But anything in this color range is normal. When you start to get into these colors, you've got high glucose, and that's an indication that there's something wrong. So we can see patient 1 is definitely at the end of the chart. Their strip has turned brown, and they have quite a bit of glucose in their urine, whereas patients 2, 3, and 4 have a normal level of glucose. So they are negative for glucose, patient 1 is positive for glucose. The next thing we're testing for is for protein. Protein should not be found in urine. If you've got kidneys that are not working properly and not allowing proteins to get into the urine, it could also be a sign of blood in your urine, which is also not a good thing. This blue solution is called Barrett reagent, and it turns a purple violet color when it comes in contact with peptide bonds. And if you remember when we learnt about amino acids, which make up proteins, when they join they form a peptide bond. So you don't find that in a carbohydrate or a fat. So when this changes color, it's a good indication that we have protein. Now because it normally turns a purpley color, but we're mixing it with this yellow urine, you're probably going to get a color change to a greenish color, which is just the two colors mixing together. So what we're looking for is if it turns a reddish color, because that purpley color mixed with the yellow is going to be sort of reddish. So simply we're just going to add a couple drops to each one of these, and this is the reason why we're wearing goggles. It's a very corrosive solution. It has a high amount of sodium hydroxide in it, which would be the same ingredient you find in things like Drano. So you can imagine you don't want to get it on your skin, you don't want to get it in your eyes. So if you take a look at your samples, the reddish color is showing up in patient number 2. So it appears that patient number 2 has protein in their urine. The last thing that people would do in this urine test would be to actually make microscopic slides and look for what we call casts, which are like cells, and also crystals. And you can tell what crystals present by the shape that they make when they dry on the slide. Because this is simulated urine, we're not going to actually make slides. If you're interested in seeing what those crystals sort of can look like, you can always ask to borrow this from me. It's a slide of uric acid, and you can actually see what that would look like underneath the microscope. In your lab, your table that indicates whether cells were found are already marked for you. So use all 4 of your tables as your evidence for what you think is wrong with each patient. Don't forget to also read what the description was of their symptoms when they went to the doctor, which is in the case studies on the back, the very last section of your reading package. So when you go to answer your questions and you're asked for your evidence, I would expect that you have at least a minimum of 3 reasons for why you diagnosed each patient the way that you did. Good luck.